What does a normal blood pressure reading sound like? Have you ever wondered what a normal blood pressure reading actually sounds like? Understanding this can help you grasp the basics of hypertension and how it is measured. The process of measuring blood pressure using a stethoscope is called auscultatory blood pressure measurement. This method relies on listening to specific sounds as a blood pressure cuff is deflated over the brachial artery in your arm. When the cuff is inflated, it compresses the artery, stopping blood flow and creating silence. As the cuff pressure decreases, the first sounds you hear are known as Korotkoff sounds. These sounds indicate the pressure at which blood flow begins again. The first phase, known as phase 1, is where you hear faint, repetitive tapping sounds. These sounds increase in intensity and mark the systolic blood pressure. This is the maximum pressure in your arteries when your heart beats. Moving on to phase 2, the sounds soften and take on a swishing or murmur-like quality. While this phase is interesting, it does not hold clinical significance for measuring blood pressure. In phase 3, the sounds become sharper and crisper, often as loud or louder than in phase 1. However, like phase 2, this phase is not used for determining blood pressure values. Then comes phase 4, where the sounds suddenly become muffled and soft. Traditionally, this point was used to mark the diastolic blood pressure, which is the pressure in your arteries when your heart is at rest. Finally, in phase 5, all sounds disappear completely. Modern practice often uses this silence as the diastolic blood pressure because it is more reliable, especially in adults. In a normal reading, you will not hear any sounds when the cuff pressure is above the systolic pressure, as blood flow is fully blocked. As the cuff pressure falls below the systolic pressure, the first tapping sounds appear. These sounds continue to change through the phases until they fade away at the diastolic pressure. Understanding these sounds is important, especially when it comes to hypertension. If the systolic or diastolic pressures are elevated, it indicates high blood pressure, which may require management. Proper technique, including using a good stethoscope and ensuring a quiet environment, is key to accurately detecting these sounds. This knowledge helps differentiate between normal and high blood pressure readings, guiding appropriate clinical decisions.